That you can do, most importantly, first and foremost, is your diet. As you mentioned, the things you put into your body. Keeping it in this country, we tend to do a lot of heavy carbs, pastas, breads, that kind of stuff. So limiting that and incorporating more fresh fruits and vegetables and lean meats and that kind of thing. And of course, daily exercise, getting a good routine of going out and doing something, for at least 20, 30 minutes, whether it's walking or if the joints ache, using a bike or doing water aerobics or swim.
Yeah, very good. Thanks again for that call. Wanda is on the line now.
What must you have on the road?
Wanda, go ahead. What's your question?
I am curious to know about the progress being made regarding triple-negative breast cancer. I am a triple negative, and I know that there's not a whole lot known thus far, but it's, there's work being done. I'm African American. I've understood that it is prevalent somewhat more in African American women, and I'm very, very on top of my body and medicine, and I would like to know what your take is on that.
Great questions, Wanda.
Yeah, I tell you, the triple negative is definitely a trickier area to evaluate, and there are definitely different kind of anti-hormone medications that one can take. It really just depends on those receptors, which is what you're implying, the triple negative receptors, and it depends on what stage the cancer was diagnosed. This is really a question having to deal with more with therapy, more with an oncologist. So,
well, and that also reminds us, too, why clinical trials are so important, particularly getting African American women involved in clinical trials, because even as Wanda mentioned, that higher risk for certain types of breast cancer in certain ethnic groups. And if we don't know enough about why it's happening, we can't find those better treatments.
Right. And I would really just encourage you to she should talk to her oncologist. And if you don't currently have an oncologist, then get referred to one so you can see what those different clinical trials are available and what the current latest medications are to help prevent that cancer returning.
All right. Let's go to our next caller. Thanks for watching Docs on Call. What's on your mind?
Yes, my mother and her mother died of breast cancer. I'm 44 and I do my mammograms and everything that I'm supposed to do, but I was wondering how much of a good idea would it be to do the BRCA test?
Another good question.
Yeah,
BRCA testing.
That is a good question. If I don't know if your mother or your grandmother would have any desire to also do the BRCA testing. I mean, it's going to depend on how many different family members have had cancer. If they are diagnosed if they were diagnosed at a younger age, it's definitely something that you should consider doing. Now, as one ages, any cancer is more likely, particularly breast cancer.
Well, and she said she was only 44 right now, so obviously she's looking at it from a preventative standpoint.
Right, yeah, and I think you just have to understand what the outcomes are with the BRCA testing. There's different things that you can do to help prevent cancer. Some women take a very aggressive route if they find out that they are BRCA positive, or just try to get better screening done if they test positive.
Angie is on the line now. Thanks for watching Docs on Call. What's your question?
My question is how hard is it to do a mammogram with breast implant?
Yeah.
Another interesting question.
Actually, it's done pretty easily. Implants can be placed either in front of the muscle or behind the muscle. And when, in both situations, the technologist actually pushes the implant back or pulls the tissue out in front of the implant, and that's how the technologist gets the picture of the tissue. That's easier to do when the implant is behind the muscle, because then that muscle gives a little bit more, and we actually get a very good look at the tissue when it's behind the muscle. It can be a little trickier when it's in front of the muscle, but now with digital imaging, we are able to see around that implant even nicer because we can just see the tissue detail better.
I had no idea that it could go behind the muscle.
Yeah.
Okay, interesting. But either way, you say, that especially with the the digital mammogram now, it's a lot
it does make it a lot easier.
Well, and Dr. Joseph, if I can include you in this way too, again, as the expectant mom or expectant moms out there who are also thinking about breastfeeding and whether that lowers your risk for breast cancer or not. What do you tell women about the benefits of breastfeeding and if there is a connection?
Yeah, well, we'll start off first with the breast cancer connection. Basically, the more menstrual periods you have, the more the thought that your risk of breast cancer goes up because of the hormone swings and that kind of thing. When you're breastfeeding, you're going a longer time without having menstrual cycles. So that's a potential benefit. I don't specifically know of any evidence saying that breast cancer or breastfeeding has specifically lowered the risk of breast cancer, though, I should say. And the second half of your question.
No, I think that's in general, just the general health benefits.
Absolutely.
Not even just for baby, but for mom as well.
Yes. Well, I mean, first of all, there's that wonderful, mom-child connection that I'm looking forward to. But also, it does, when you breastfeed, especially like shortly after you give birth, oxytocin, it helps to pump oxytocin in your blood, and that contracts your uterus and helps stop the bleeding, for instance. That's one benefit. But then, of course, I think a lot of people know the benefits to babies are antibodies and things that fight infection, and also just all around natural good nutrition for your baby.
Very good. And you sparked another interest in my mind in talking about hormones. And we talked some there about estrogen, and then what the breastfeeding, how that, especially initially, what that does inside the body. As women are growing older, and we don't have to be growing that much older to know when our hormones are changing and when our metabolism is changing. Do either of you have a good bit of advice, whether it's just solid in medicine or just common sense, that you give women about growing older and how to accept some of those biological changes?
That's a good question. I actually get this question in quite a bit. Women do find that their body changes. They lose a little bit of muscle mass and they gain a little bit of fatty tissue after going through menopause, unfortunately. And sometimes they notice their body shape's a little different, and it, sometimes makes them a little bit self-conscious, or feel like they're having a hard time getting off the weight. I really encourage just a positive self-image, and again, not to worry so much about what you look like and getting on the scale, but more just that you're doing the right things to make you feel healthy. So eating right and exercising often. People notice, even if they're not changing or not losing as much as weight that they helped, but they just feel better and they feel more healthy, and eventually still the pants will fit better. So
that's right. And Dr. Gingrich?
There is an increased risk of breast cancer with combination progesterone, estrogen, hormones. So I always encourage patients just to talk to their doctor regarding the risks and benefits. I definitely are seeing a lot fewer women being placed on the combination type hormones, and I think healthy lifestyle and trying to use other alternatives to help make your image feel okay is the way to go.
All right. Thank you both for some really good advice and great conversation this evening. Thanks to you, our viewers at home, for watching and calling in with those great questions. And remember, we will be back with Docs on Call 2 weeks from today. Until then, I'm Gina Morse. Have a great night.